Hello, my name is Aaron Ng. Today I'll be discussing lung cancer for Dr. Poon's Biology 1010 class as my signature assignment. Um, we'll be saying what it is, why is it so dangerous, and how we diagnose and treat it. So lung cancer is basically when abnormal cells in the lung start growing out of control. It's actually the number one cause of cancer deaths worldwide. I'll be covering the main things we need to know, what causes it, who gets it, how it affects the lungs and symptoms, and how they show up, how doctors treat it, and including how AI is now helping with diagnosis and treatment. So, some lung cancers start because of changes in our genes. The big mutations doctors typically look for are KRAS, EGFR, ALK, and TP53. These mutations mess with normal cell growth and let the cells multiply too quickly. Some people also have inherited risks that make them more susceptible to developing lung cancer. Now AI is available to help scan DNA data to help predict someone's cancer risk. Smoking is by far the biggest environmental cause for developing lung cancer. About 85% of lung cancer cases come from it. For people who don't smoke, radon gas is the top cause. Other environmental risks include things like asbestos, air pollution, and diesel exhaust. All of these damage lung tissue over time and increase your cancer risk. Etiology and behavior factors. So behavior also plays a significant role. Secondhand smoke is a big one. Chronic irritation or inflammation in the lungs can make cancer more likely over time. Vaping is popular now, but that's a huge one, and marijuana smoke is also something that can irritate your lungs. AI tools are even being used to help predict when someone is trying to quit smoking and may relapse. So demographics, who's affected in the USA? We see about 234,000 new lung cancer cases every year. Lung cancer is the most common in people over 65 years old. It used to be mostly men, but now rates of women are increasing steadily. And interestingly, 10 to 20% of cases happen to people that have never smoked before. So demographics of US versus the world. Worldwide, there's about 2.2 million new lung cancer cases every year. Death rates are higher in countries that don't have strong screening programs. Early detection really matters, and globally, pollution plays a huge role, especially in places with poor air quality. So anatomy overview, to understand lung cancer, it helps to know how the lungs are set up. Air comes through the trachea, goes into the bronchi, into the bronchioles, and then ends up in the alveoli, which are these tiny air sacs that do all the gas exchange. Most lung cancers start in the cells lining the bronchi. So as lung cancer progresses, tumors can block major airways that make it harder to breathe. If if the cancer spreads to the pleura, which is the lining around the lungs, it can cause chest pain and fluid buildup. Lung cancer also commonly spreads to areas like the brain, liver, and bones and adrenal glands. So physiology disruption, because tumors block the airways, oxygen levels can drop. The alveoli also gets damaged, so gas exchange doesn't happen as well and is poor. And tumors can grow new blood vessels, which feed themselves, which also helps them spread. Early symptoms include cough that doesn't go away, wheezing, feeling out of breath. The later symptoms, you may develop coughing up blood, chest pain, fatigue, weight loss, and eventually possibly death. Survival rate and outcomes. So survival rate really depends on the type of lung cancer you have. For non-small cell lung cancer, it's a 5-year survival rate, which is about 26%. For small cell lung cancer, it's only about 7%. So without treatment or intervention, lung cancer can lead to respiratory failure or spread through other organs. Catching it early definitely improves your chances of survival. So diagnosis. Doctors usually start with imaging like X-rays, CT scans, or PET scans. A biopsy is needed to confirm it's cancer. So basically, you go in there with a scope and then they pluck out a tiny piece of your lung and test it. They also run genetic tests to see if there's certain mutations like the EGFR, ALK, or ROS1. AI is now being used to help spot tiny nodules on scans that humans might miss. Treatment options. So treatment depends on the stage and the type. Surgery is usually the most common or often used for early lung cancer. You can use chemotherapy or radiation therapy, which are also another alternative. Targeted drugs go after specific mutations, and immunotherapy helps the immune system recognize and attacks cancer cells. AI and treatment. So AI is huge. As a respiratory therapist who's been doing this for almost 13 years, AI is now stepping in the last few years. It can help us read scans more quickly and sometimes more accurately than therapists themselves. It predicts which treatments patients are more likely to respond to or not to. It also helps build personalized treatment plans, and it can help even detect cancer coming back sooner. These are my references. Thank you for listening. And as a person that's worked in the field for respiratory therapy, it's a, special subject for me because I've helped a lot of people with lung cancer. So it's been a privilege to discuss this one. Thank you.